Okay, low stress handling of difficult dogs and cats in the hospital and shelter setting. The facts for people who work with animals is that 90% of hospital injuries are due to dog and cat bites. And for hospitals in the US, that brings us to about $1,500 per workers' compensation claim. And we also know that at vet hospitals that fewer and fewer people are bringing their animals in because they feel that their animals are stressed. So a lot of people are choosing to not bring their pets in because their animals are stressed, especially cats, but still a high proportion of dogs. And why does this happen? Why are so many people bitten, and why are so many animals difficult to handle? Well, first of all, how many of you guys work with cats? Okay, and how many of you have cats? Okay, so quite a few. So here's a typical
I'll just stay away.
Exam.
Ted, you're scaring me.
Uh-oh, he's out.
So interestingly, even though he has the cat in the net, he still has poor control of the cat. So it's going to take him about 3 or 4. Well, that one he got in the second injection, but watch this next one. It's going to take him how many pokes? 1, 2, 3, 4, 5 times. So a lot of cats are handled like that when we could instead handle them like this. Now I'm just putting a towel over the top. It would actually work better if I put it from the back and then I kept this on the front. But the most important thing is have all the doors closed and make sure your ceilings don't open. Because they can get stuck in the cats can fly into the ceilings. So a lot of these cats that seem really aggressive, they just want to hide, and if you can get a towel over them, even though they may be hissing while you do this. Then here, I actually put a second towel over the cat. You could use gloves, but I feel like I can't feel the cat well with gloves, so I put a second towel over. And then I'm just able to lift the cat out, and the cat actually does not try to struggle because it's able to hide. Look, the cat's still there. And from here, usually I would have a technician holding. And the technician would put their hand right behind the head. But I'm just doing this by myself, so I close the front of the towel. There's just enough support so the cat knows, well, it's not that easy to move in this direction or that direction. And so I can palpate the abdomen. I could listen to the heart. I could look at the rear end. I can feel his bladder. I can check the bladder. And then from this point, if needed, we could just take blood. So here, it's easy enough for me to hold the cat, and then the technician can take blood. So she's still there. And then all I have to do is aim her towards her crate and then open the blankets or the towel. And now I can actually reach in and touch the cat. Now, I'm not saying she loves me, but she's not trying to kill me. So of these two cases, which do you think the client would prefer, A or B? B. Which way do you think takes longer and costs more and is less thorough, A or B? A. How about which cat's more likely to be easy to handle the next time? And then which handler would an employer find more skilled? B. So one big question is, why are so many pets uncooperative? And what should we do? So why are kids uncooperative at the dentist? Yeah, because they're scared, right? And usually at the dentist they don't strap them down. Sometimes they do, but usually they don't. And in fact, there's a whole business niche based on understanding the behavior of kids. It's pediatric dentists. They don't need to muzzle the kids or strap them down because they know about their behavior. And so here's an ad for one. It says, 5 reasons kids love to go to the dentist. 10 cartoon channels, videos, and G-rated movies. Cool dentists, super nice assistants, headphones, Game Boys, and kid-controlled remotes. Now, how often do we hear about something like that with vet hospitals or groomers? Not that often. It's most likely, we can cut hair. We can make your animal medically better, even though we ruin him behaviorally. Now, our goal as caring pet care professionals should be to provide a good experience. So a lot of times people are just rushed to get through things, and when we think about it, well, why did you become a vet? If you want to rush through, go be a doctor or something. So that's what I think. Which of course I wouldn't want to go to that doctor. But our goal is provide a good experience. Our goal should be to provide a good experience. If we got into this field because we love animals, our goal should be because our goal should be to provide a good experience. And our second goal should be make the animal better, not worse. I mean, medically we say we don't want to do no harm. We don't want to make the animal worse. Well, that should include behaviorally. We don't want to send a dog out okay and then the dog comes in okay and then goes out aggressive. Well, in order to provide that good experience and make the animal better, not worse, it means that we have to be aware that the animal learns something about us with every interaction. So with every interaction, it learns that we're either friendly or we're not, and that we can help guide him or we can't. So the question is, how do we go from the old way of using force to the new way of using finesse? Well, we already have some skills. We already know how to recognize fear and anxiety, and that's huge. We also know that fear can turn to aggression, so we need to address it before it turns to aggression. And we even know how to recognize that it's fear in dogs who are already aggressive. We know that a lot of times people have been making it worse by greeting the animal incorrectly, and we know how to avoid that. We know how to greet the animal correctly and approach the animal correctly every time now. And on top of that, we know how to desensitize and counter-condition to specific things. So for instance, we know, if the dog is bad for having a toenail trim, we know how to train it to like the toenail trim. If a dog is afraid of people, I showed how we use the treats to get him comfortable around the people in this hospital type of situation. So it's not something I don't go telling people off the street, do this with my dog. I'm talking right now, I'm in a professional setting, the person who knows what they're doing is the one tossing the treats. Does that make sense? If you go do this out in the street, somebody's going to do it wrong, and then they're going to go over threshold and cause the dog to be aggressive to them if you have a dog that's at risk of biting. But what I'm talking about now is we're in a situation where I'm the professional and I'm dealing with a difficult dog. I know that I can just counter-condition a dog by tossing treats, and then when it gets more comfortable, I can practice counter-conditioning it to being touched. So one question people have, or often what they think when they think low-stress handling is, I don't have time for that. I just need to get things done. You don't understand. I need to get things done, is what they think. And then I think, they're thinking it can't be done in a hospital because it takes too much time. And I'm thinking, it doesn't take more time. It just takes more skill. Do you not want to have more skill? And sometimes it takes more planning. Well, versus not having a plan at all. Takes planning versus not having a plan. So in this lecture, we already have solutions that don't take more time. So desensitization and counterconditioning can take more time. Sometimes it doesn't take any more time, but sometimes it does a little bit at the beginning. What I'm going to go over in this lecture is additional solutions besides greeting correctly and recognizing fear. So I'm going to go over additional solutions that require more thought at first, but do not require more time. So these are additional solutions that require more thought at first, but not additional time. So these are several general principles of handling, and each can make the difference between whether the patient is fractious or cooperative. So 7 principles, and each will make the difference between whether the patient is fractious or cooperative and friendly. So principle 1 is set up a comfortable environment. We want the animal to feel safe. So how can we do this? Well, if you have a dog that's nervous or a cat that's fearful, bringing it into a waiting room that looks like this is asking to be bitten. So this cat, by the time it goes into the exam room, you better be wary because it's going to be ready to bite or scratch already because it's already been scared in the waiting room. So what we want to do is make our waiting areas calm and comfortable. So what we want to do is, for instance, make dividers so we can have separate dog and cat areas, or if we can't have that, we can put room dividers in. We can visually block the access. So for instance, with cats, we can cover their carriers. We can elevate their carriers. Here I've just put a towel on the carrier. We can also use dog appeasing pheromone or feel away, which doesn't work on 100% of animals. It probably works really well on a few animals. But the ones that it works well on, it works really well on. In this case, this dog's pretty nervous on this exam table because it's just a metal table. And all I need to do to make this dog more comfortable is put a more comfortable surface. So just putting the towel there. So for dogs in rooms, dogs and cats, I like to have a rug there. It may just be a bath rug, but it makes a huge difference. Here, cats, you get this cat that seems like it's going to kill someone, and all you do is you put a towel over it, and suddenly you're like a god. You can get the exam done that nobody's been able to do for 3 years. A lot of times these cats like to be on scales, and the reason they like to go on the scale is because they have the 2 sides, so they feel like they can hide. So if you see a cat going into this type of situation, that's why it's doing it. Now, just because you made it through the exam doesn't mean you're safe, because what if your treatment area looks like this? So you have to remember it should be comfortable and safe even in the treatment area, or this. Here, so in this case, has anybody been working on a cat and somebody turns on the clippers and your cat freaks out? That's common. So what we need to do with noises is sort of desensitize them. And that desensitization is going to take all of 10 seconds or 5 seconds. It's turn the clippers on, down here, low, next to your side, and then once the cat just remains stationary and does not show any signs of fear, then you bring the clippers up to the cat slowly. 10 seconds of desensitization. In this case, okay, we just make sure dogs do not get in cats' faces. But remember that a lot of dogs are afraid of other dogs, and a lot of cats are afraid of other cats, and a lot of cats are afraid of people, and a lot of dogs are afraid of people. So we need to give them as much privacy as they need. And often that means get them into the exam room as quickly as possible, and then you may need to do the treatments in an exam room or some room that's quiet. Here's another example. This is cats that like to hide. This is another cat that was caught in a feral cat trap. So this is a feral cat found in a trap. This particular cat just wants to escape. So here's where I would have somebody put their hand on the cat's neck. It's good to have several towels available so that you always have one that's in position to help cover the cat's head and prevent forward movement. I've got to be quick in adjusting my towels. Alternatively, the technician can place a hand over the cat's neck to prevent it from moving when you adjust the towels or perform your exam.
From this position, I can listen to the heart and palpate the abdomen. I can also remove the towels from the head and perform a full head exam. Be sure to keep the towel wrapped around the neck like in a burrito wrap to prevent the cat from bolting forward. Also have a tongue depressor available if you plan to examine the mouth. Lastly, we're able to take blood from the medial saphenous due to the snug blanket wrap. This cat is comfortable enough so that she doesn't struggle. If she did struggle repeatedly, we would sedate her.
So notice the purpose of the towel is so that they feel comfortable and safe. It's not that I'm holding her down while she's struggling and screaming. It's that I made her feel safe in that so she wouldn't struggle and scream. And if I did think she was going to keep struggling, then I would hurry up and give her a sedative, an injectable sedative, through the towel. Now, for the towel wraps, there are a number of specific towel wrap techniques. So here's just one example.
This wrap also allows access to the head.
So the goal is to put this on before the cat becomes fractious. So you're putting it on to keep the cat feeling comfortable and safe. And this is something that if you do it at home for your own cat, or you think it's going to be done repeatedly, you should practice doing this and having your cat eat its meal. So from here I could clean the cat's ears, examine its eyes, its mouth. And then I could also loosen the back also.
Here's a variation that provides access to the front leg.
So this is a scarf wrap. And on the cat towel wrap DVD, that specifically breaks it down into all the steps to do these wraps. So this particular version I can use to take blood from the front leg. And if I have enough towel wrapped around the cat, then there's a lot of protection for the person who's going to take the blood. Their hand doesn't need to be near the cat's face anymore. So there are a bunch of different types of towel wraps. Most of them are for use before the cat gets really anxious. But there are some emergency wraps, and when you use the emergency wraps, often you can still go ahead and do the procedure that you were doing. So by emergency, I mean the cat escaped, or it's going to attack you when you need to get it out of a cage. And so here's the wrap, and you get it on in 1.5 seconds. So principle 1 was set up a comfortable and safe environment. Principle 2 is that we need to control movement. We have to prevent pacing and squirming, and we need to lead in a way that the dog knows what we want. For instance, here, often I'll see dogs in a room and they're pacing all over, and the more they pace, the more anxious they can get. And really, in this case, all we need to do is shorten the leash. So here she holds the collar, and when you do that, you don't want to go like this, because then you're lunging after the animal. Instead, you want to just walk your way down the leash. Walk your hands down the leash. So now she's holding the collar, and the dog understands, oh, you don't want me to pace all over the place, and then the dog just sits. Here's another example. This dog belonged to a friend, and the friend said, I don't know how you control her. I brought her to the vet, and she was out of control. And that's because I do things like this. So here, I would have taken her and she would sit, and then I would hold her collar when I get down to her level so she knows I want her to stay, and then she stays, and she's nice and calm. What they most likely did was something more like this. So let's say she sits. You do not grab her collar, you just get down to her level, and then she climbs on you because that's a solicitation to get up on you. That one difference is the difference between whether the dog will be calm for the rest of the exam or will get more and more aroused. So that does not take more time to do. It just takes more knowledge and skill. I just held the collar. And you saw this dog already. Remember the different, with this dog, I controlled the dog's movement by having her going into her kennel, approaching sideways. The wall is on one side, I'm on the other side, so she can't move either way, and as a result I'm able to hold her collar, and because I'm holding her collar she also can't move backwards, and because I have control of her I'm able to get this leash muzzle on, although slowly. And then finally when I get the leash muzzle on I have control of her head, which allows me to pet her, and then I'm able to find out that she enjoys being petted. Does that make sense? It was all my ability to control her movement in a way that wasn't scary for her.
Yeah, 'cause it's leaning his head back.
Okay, here's another example.
Fearful dogs are often better for venipuncture if you use the lateral saphenous. The owner or a second technician can restrain the dog while it's standing against a wall and distract the dog with treats or vigorous petting. Canned cheese or liver paste works well as a treat, especially if the dog is wearing a basket muzzle, which makes it harder to administer other treats. The person restraining the front end should be sure to hold the leash short enough so that the dog can't spurt forward. The handler restraining the rear should start by touching high up on the leg and then running the hand down the leg to the part the person drawing blood will hold. If you just grab the foot, the dog will often pull its leg away.
So here we're controlling the dog because there's a wall on one side, and then the person is standing right here against their chest, and then I'm controlling the rear end a little bit.
When the blood is about to be drawn, the handler in the front should be sure that the dog is distracted.
So this dog actually likes the patting on the head. If the dog does not like that, don't do it. People don't just randomly do things because you saw somebody do it. You always have to pay attention to the dog.
This draw was easy compared to what has happened to her in the past. On her last visit, the technicians held her as she struggled, growled, and screamed in order to take her blood. This time she leaves happier than when she arrived.
So you can see she's leaning into the petting there. Now it's also really important how you get a dog from place to place, because often we go from place to place and the dog has no idea what we want. So here's an example. When you walk a dog, if you want to walk them in a way that they know where to go and they're focused, you need to walk at 125 to 135 beats per minute. That speed is the speed at which they're generally at a fast trot. So if you're outside and you say you have a reactive dog and you're in a situation where he might be reactive, you need to be walking 135, 125, that pace where he's at a fast trot. So for instance here, looking at, if I walk in slow motion, this dog has no clue we're going somewhere. So he's just going to go wherever he wants. If I'm walking at this faster pace, the dog has an idea, oh, we're going somewhere, so he knows to follow. So in one situation, it looks like this. So if you're walking too slowly, this dog is already trained, which is why it's even staying with her for this part. Now she's walking so slowly, the dog goes, well, I guess I'm going to sniff over here. Like, I have no clue what you want from me. So the person's walking too slow, so the dog just does whatever. So even with that bouncing dog over there. So at the faster speed, at least the dog has an understanding that we're going somewhere. You're trying to direct me somewhere. Now, a huge thing is often when people want to get the dog from one location to another that's not very far, they'll just take the dog and try to pull it with their arms instead of using their body. So that's what would be like, I say in dancing, I always say lead like a partner in a dance. Well, in a dance, when you want somebody to move, you don't go like that. You actually step your body somewhere. Your body moves to get them to move. So here, what you'll see here is how confusing it is to the dog when you try to guide them just with your arms without actually moving. So here she wants the dog to take that turn, and it wouldn't take it, so she's just trying to pull on the leash. And the dog's balking, and now the dog is scared because the dog has no clue what she wants. So imagine if this happens to your dog in the hospital. Why should your dog trust the person? They're just being mean. They're not giving any direction, and then they're getting mad. So here's, again, guiding with the movement around that corner. So she's walking, 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 walking. She's going to turn the corner, and here she speeds up a little just to give a little more direction. Now, another thing that we need to do is we need to make sure that when the dog is getting into position, that it's on a loose leash. Because often what people do is the leash is tight no matter what. Well, if the leash is tight no matter what, why should the dog try to do what you want? The leash is just going to be tight. So I'll tell people I would like the leash to hang in a loose U, which means that you have to usually hold your hands down lower. You're not, like some people will hold up here. Get your hands down at your waist level. So you can watch here. The only time the leash should get tight is if I need to redirect the dog by speeding up. So for instance, here I turn and then I speed up. And this is my neighbor's dogs. Whenever, they're not trained, so whenever I need a naughty dog, I borrow their dog. She just doesn't. But here she understands if I change directions, then I'm going to speed up a little bit to guide her in the new direction. And as soon as she starts catching up, I'm going to make sure that leash is loose. Because if I continue with a tight leash, then she's not going to try to catch up. She's going to balk. And I would say in the hospital situation, you're not walking 135. 135 is kind of fast because there's not really enough room. You're usually walking. You're not walking the same speed you would walk if you were getting past that reactive dog. Okay, here's an example because some people said, well, my dog's not motivated for food because he's too scared outside. What do I do? Well, number one, you learn how to walk right. So here's just showing you the importance of moving correctly. So this is a dog that came from the shelter, was highly reactive in that if he is scared, like if you walked up to his cage, he would go, then if you stuck a treat in his face, he'd go, oh, food. But this dog, Melissa, my assistant, took the dog through the Learn to Earn program. So in a week, the dog was way better. But it turns out not better for other people. Anxious, you get those dogs, they glom onto one person, and then they're scared with everybody else. So here, this dog has learned to focus well, but will not focus on this new person. Just wants to get back to the foster parent. So here, the dog will not eat treats consistently, so I just put a gentle eater on the dog. Now, normally, I want the dog to be counter-conditioned to a gentle eater, but I didn't have time here. So in real life, sometimes you do whatever you have to do. So what I would like to do is get the dog moving, but stop before the dog gets out of control. So I'd like the dog to move in straight lines, not pacing all over. So I'm going to do the best I can do to get that right now. So I'm moving, straight line, stop before he rushes past me. Then ideally he would sit. He happened to sit there and he got a treat. Not interested in the treat? Okay, then I'm just, okay, took the treat. I'm just going to walk. This dog, again, it would be better if the dog had learned how to walk on a gentle leader at home first and enjoyed it. So what I'm going to do is take the dog across outside so we can have more room to walk, and so you can see this better. But I'm going to walk. If the dog's feet start getting ahead of mine, I'm going to stop. Because if the feet get ahead of mine, it means he's going to be on a tight lead in a second. I want to stop before he gets on that tight leash. So I'm walking. Before he gets ahead, I stop. He goes to the end. I can't get him to sit yet, so right now I'm just happy with him standing. Walk. Stop, because he's going to get ahead. Okay, then I'm going to walk again. Right now I can't get him to sit, so I'm just happy with having him stop. That time he happened to sit. He happened to also take a treat, but that was out of luck. I stopped again. You know, I tried to tap his rear end to see if he'd sit, but no, he won't. And that's okay, he's scared, so I'm not going to push him. I just want to give him hints on what to do. There he sat, not really taking treats. He kind of likes the petting, so I'm using petting as a reward. Walk. He stops. Again, I'm always stopping because I want to walk to get him moving, but I want to stop before he gets out of control. Because it doesn't help if they're pacing all over. If they pace all over, they're going to get more anxious. I want him walking in a straight line. Okay, now he's starting to respond more consistently to my touching his rear end, or even just stopping. So there, touch his rear end and he sits. And now he'll take a treat sometimes. There he sits. And his foster mom says that normally in this environment, even with her, he'd be nervous, so he wouldn't be able to focus on her. So now he's sitting on his own and looking. I still have to stop frequently because he's going to start getting ahead of me. Okay, so now he's looking even just to heel. He's learned these behaviors already, just not for other people and in a new environment. And I would guess that my pace is probably like a 130 right here, 130 beats per minute. Okay, so now I'm going to have a student work with him. So the speed I want him at is a fast trot. So it's also transferred to her because she's doing the technique similarly enough. When I stop, my goal is hold the leash so he can't go forward. So ideally, I just hold my hand down here because the easiest way to keep him from going forward is it's not to pull up, because if you pull up, that's not going to help keep him from going forward. It's to hold down here so he can't go forward. But he does already know that if you guide his head up a little bit, to sit. So sometimes I do that to help him sit. But I would not do that on a dog that had not learned that. We taught it by lowering his head while we guide up. So that took 20 minutes. So I can either make her better in 20 minutes, or he can, otherwise what's going to happen is he would stay at the hospital and he'd never get better. Does that make sense? Because he'd probably never eat. He would just be in the same situation the whole time because I did not take the time to walk him, practice the walking and stopping, walking and stopping. So the walking helped him feel comfortable, and the stopping kept him under control. And then when he started feeling more comfortable, then he took treats. So then once he took treats, I didn't need to do that anymore. I could just stop, and he would stop. Does that make sense? So I will do that because sometimes in dog class, like the last dog class we had 3 dogs that were anxious because they hadn't been socialized enough and they wouldn't take treats. And well, you won't want to go a whole dog class and nobody got anything done with their dog. So those people had to practice learning how to walk in straight lines back and forth. And it is important walking in a straight line. It seems like that would be easy, but it's hard for people. So they had to practice walking in that straight line and then stopping before the dog could bolt past them. And then by the second class, the dogs were more relaxed or happy, and then by the third class, they were walking nicely.
So when they bolt in front of you, do you make them come back towards you? Or
If they got too far in front of me, then it depends on what that dog can do. But what I was trying to do, when I was doing this, I wasn't really watching how I was demoing, what it looked like. Like, sometimes you do it and you're like, oh, well, that's not how I want to see what people, so what I would ideally do is this dog who I know I need to control but doesn't really know that much, I would hold the leash, hold my hand down here. So if the dog's head level was down here, it would only go this far. Because if I hold my leash up here, the dog has way more room to move. So there's less guidance. If I can get my hand down to the dog's level, so if he just walks forward, his head is just at this level, not getting pulled up, then it's easier for him to understand when to stop. So ideally, I would get him, I need to allow him at least that the leash will be loose unless his feet get ahead of me. So I need to have the leash probably this long, this long, this long. For this size dog. If you have a small dog, it's harder. So that once he steps by me, he only gets one step past me. That second step, that leash is going to make a clear tightening. And I need to make sure that as he's starting to get ahead, I stop. Otherwise, he's going to get to pull a step, so it won't be clear to him. Does that make sense? It sounds like you have to practice because you have to feel what it feels like. Then he understands that every time I get my foot ahead, I'm just going to get to the end of the leash, so I might as well stay back here, or he knows, oh, I expect to sit quickly. So I'd like him to stop before he can turn his rump all over the place. And, if you need help, then try to do it alongside a wall or alongside a curb for dogs that don't want to step off the curb. Uh-huh.
Does it matter whether the leash hooks on the back or the front?
I don't like it when the leashes hook on the back because you don't have control of the head, directional control of the head. Because I like to have the dog be able to turn towards me. So the gentle leader type leash gives the most control, or head collar gives the most control. The second choice would be a front attaching harness if you want directional control. The problem with those is if they want to jump, you don't have very much control. And then lastly would be a flat collar. And then behind that would be something on their back. Because, when it's behind their back, then they tend to pull more because no matter where they are, if it's on their back and you try to guide them, it makes them turn away from you. Okay, so principle 2 was control movement, prevent pacing, squirming, and lead in a way that the animal knows what you want. So imagine they come to the hospital, they don't even know what you want, and then they feel like you're getting mad at them. It's really confusing for a dog. Handling principle 3 is support the animal well by having your arms, hands, and body positioned correctly so the pet feels balanced and controlled. Now, how many of you have seen this? Call it the judo method of getting the dog from standing to lateral. So they just bonk their head. This is common. Somebody's trying to position a dog, the dog struggles, and it bonks its head. That would be like you going to the physical therapist, and the physical therapist wants you to lie on your back, so they grab your feet out from under you. You would probably leave, and yet our dogs put up with us. So what we would like to do is when we change positions, we want to do it in a way where the dog feels supported. Oops. So this dog Zoe is in standing. I just roll her down my legs, and then She was 17 here, so she gets a treat. But I just lifted her feet off and rolled her down my legs, or slid her down my legs. So I could have stopped in any position and she would have felt supported. Now, when we're talking about supporting the animal, we want our hands and our body to work together. For instance, if I was rotating this ball, if you said turn the ball over, you wouldn't expect somebody to do it this way because then the ball could possibly drop. A better way is to just rotate this hand to the other side. So the hand is just going to rotate this way. The hands are working together. Now if you look at this example, in this case I'm going to put the dog from standing onto its back. And your hands have to work together when you do this. So just watch how the hands move together. So the left hand is way on his hip. And you'll just see both hands are moving at the same time. And then the dog's going to end up in a comfortable position. And then compare that to this. Luckily, this is her own dog. Because what's wrong with this? This dog has no clue. Like, what are you doing with me? Again, can you imagine this is happening every day, and yet our dogs put up with us? If we were at a hospital and somebody did that, oh boy, we'd be like screaming. So did you notice what she did? There was just no coordination between what they were doing. There was no support here and from the top. There should have been this motion. Now when we are supporting the animal, we want to think that we're not putting a death grip on the animal, rather we're putting safety bars in the correct places. So when we're restraining animals, we want to think about controlling left, right, up, down, front, and back. And the wider our safety bars are, so on a roller coaster we have the safety bars to hold us in place. The wider those bars are, the more support. So the increased surface area equals more support. So here, if you turn upside down, those bars don't squeeze you down, they just stay in place. So here's an example of different ways to support this dog. And in this case, I'm keeping the dog from moving forward because my hand's in front, backwards because my hand's behind. The dog is against my body so it can't move left. These fingers are keeping the dog from moving out towards us. And I have my thumb under his collar so he can't jump up. Now in this case I have actually more control because I have more surface area coverage. In this case he's right against my body and my whole arm is controlling the outer side. And then he can't back up because my hand is right here behind his leg, and he can't jump up because my hand is on his collar. Now this one has better control, but it doesn't necessarily mean it's the one that I should use, because a lot of dogs are going to feel more comfortable with that, and if they feel more comfortable, they're going to hold still better. So principle with 3 was support the animal well by having arms, hands, and body positioned correctly so the pet feels balanced and controlled. Principle 4 is that we actually need to know where our hands and body should be placed. So we need to have our safety bars in that correct location. For instance, if I want to prevent the ball from bouncing out like this, where should the safety bars be to prevent this from happening? Where do you want the safety bars? On the top, yes. So we want to create a ceiling to prevent the ball from popping out the top. So we can do that several ways. Oops. She can make a ceiling with her body. So here she's made a ceiling with her body, or she can make a ceiling just with her arms. Now you might ask, well, why would you ever make a ceiling with your arms? Because a lot of dogs don't want you leaning over them with your body, because they'll be scared if you lean over with your body. Okay, let's look at this dog. What's wrong here? If she wants to prevent the dog from backing out like this, where should she put the pressure? right here, right? Look where she's grabbing the leg, which is what a lot of people do. They just grab whatever and they hold it down. But the part she wants down is up here. What she did is as soon as the dog started backing out, she just let it back out. But if she had just leaned as the dog was backing out, it would have just stopped and said, oh, I guess I'm not supposed to go this direction. Now, a lot of people, you're thinking, oh yeah, I should make a ceiling so the dog can't jump up. But then what they do when the dog jumps up is they grab the legs. If you grab the legs here, the dog has this much room to move his body. If you want to grab the legs or hold the legs, you need to hold it up here. So like if somebody grabs you here, you can't move away very far. If they grab you here, you have all this room you could actually kick them from here. So what I want to do is, if I'm going to hold the leg, I want to hold up above the elbow, just 2 fingers above the elbow. Okay, so you're going to see the difference. In this case, what happened was that I had somebody clipping Jonesy, and I was holding him, and then he started struggling, and then he stopped because I was holding him correctly. And then I thought, oh, I need to get this on video with somebody who's going to restrain him incorrectly. So I had a technician, and I didn't tell her he was going to do this. Okay, so she's not preventing upward movement, which is why he gets away when he struggles at first. And then she holds his legs, front legs, which allows him to wiggle so much that he's able to get loose like this. So this is really stressful for the dog. When you don't restrain the dog correctly, it's very stressful because it allows them room to start struggling, and the more they struggle, the more scared they get. There's no guidance as to where you want them to be. So what I do here instead is my arm is all along him so he can't move out. He's right against my body, so he's controlled on left and right. I hold his leg so he can't jump up. And he also can't back up easily because my arm is behind him. And then I'm holding his collar, which helps me hold his head. And I have to have his head against my body. But because he's small, it makes it look like my arms, like I'm squeezing him. But no, it looks like I'm probably squeezing something with a death grip right now, right? Because if it's small, you got to keep your arms in. So I'm not putting a death grip on him, but I just need to keep my elbows in because he's small. And so right here, he's not trying to struggle. He's not trying to struggle because I've made a nice mold around him so that he knows there's nowhere to go. So now the next step would be, I probably should counter condition him. He's actually okay with this now, but I could have been counter conditioned him, except that I wanted him to be naughty for the video. How would you counter condition him to the clipping? Huh? How would you counter condition him to the clipper to being clipped? Yeah, so I would actually give treats, bring the clipper up, just like the grooming. This is all the same. It's all the same thing over and over and over again. You just have to look at the formula. Give him treats to make him happy, put him in a happy state, then bring the clippers close. Stop both at the same time. Give treats, he's in a happy state, bring the clippers close. As he's finishing the treats, remove the clippers and the treats. It's the same. Toenail trim, same thing. Grooming, same thing. Then I can get to the point where holding him, he's getting treats, I actually clip, and then I stop. So I am adding them at the same time. Somebody asked me, well, I heard with counter conditioning you're supposed to add it after, right? Did somebody ask me that? With counter conditioning, you've heard, with classical conditioning, people said, well, I thought with classical conditioning you need to add the stimulus, like it would be the bell first and then the food, right? Classical conditioning. That is not counter conditioning. Counter conditioning is classical conditioning is with a neutral stimulus. You're trying to teach them that something that means nothing means something. Bell means nothing. I want it to mean food to you. So as soon as you see that bell or hear that bell, food appears. So in that case, it's best to have the bell first, followed by the food. We're talking about a situation where a dog might not like something. It already has a negative association. It's like, you're afraid of spiders. You don't need that spider in front of your face first. You want to feel comfortable because you're anxious that the spider is going to appear. Then once you feel comfortable, let the spider appear. Does that make sense? So with counter conditioning, classical counter conditioning, I want to put the dog in a happy state first, because if I present the scary thing, I'm not going to be able to get him in that happy state. It's going to be harder to get him into that happy state. So I'm going to make sure he's happy, he's eating that food, then I'm going to present the stimulus sub-threshold. Then I'm going to stop the stimulus and stop the food. Does that make sense? Then I'm going to make sure he understands no food, no treat, or no treat, no stimulus, no treat. They only occur together. Okay, so let's see. So 4 was one way to keep him from jumping up was that we held the leg but above the elbow. But we can also do things like just putting our finger in the collar, and the finger you choose depends on how you're holding the dog and the size of the dog. Then we can also do, it's called a C hold. And the C hold, I have a bottle that I can show this with. With a C, let me see this. Gee, how do I usually hold this? I can't remember. I'm going to have to hold it this way. So with the C, you're just bringing the dog to your shoulder. And with this, you can see the dog can't move much. What people tend to do with little dogs is they go like this, and now the dog can move this much. If the dog can move this much, he will. So it's like this. If the dog is short, you do not go like this. So, if your dog is this level and your hand is up here, you lower your body and you go like that. Uh-huh. Oh, that's the next thing. Okay. Okay, so this person should have a C hold, but she doesn't. So Jonesy is the right size for it, then the dog steps over. And the thing is, this is actually stressful for Jonesy because he's getting into a little struggle. He doesn't understand what she's doing. Okay, so her problem is that there was so much space right here. She needed to put her arm closer to him. She needed to keep her elbow against her body, and she needed to push him up against her arm. Otherwise, there's a little triangle of space where he can just lift his leg right over. So I need to push him up all the way to my arm. Otherwise, he can step over. So I think he's going to step over right now when I'm trying to show her, like, Jonesy. Okay, so now she's going to do it, and he's too far back. See all that space? Well, there's not space, but her arm's at some abnormal angle. Can't see. She needs to push him forward so that he's against her arm. She also needs to lower her body. When we did these videos, when I was first doing these, it was really frustrating at first because we'd restrain a dog and we'd go like, oh, and here's the instructions, and then we'd watch people do it, and then they'd mess up, and we'd go like, what's going on? And then we'd have to try it again and oh, it's because of this. And then we learned that you have to show them what's wrong. Well, we already knew that. You have to show them what not to do, otherwise they'll do it. They'll think they're doing it right. So the trick about this is that Often when people go to get their arm around the dog, they're like this, their elbows out. If your elbow's out, the dog can just step over. You need to keep your arm against your body, and you need to start with no arm. You just have a hand, and the dog's neck is right here. So you just have a hand, and it goes like that. Versus people will go like this, like that, and try to come in. But if you have a dog that wants to step over, if you do this, suddenly you have all this space for him to step in before you can get your hand in place. So here's the dog, my hand is right under his neck, and then I just slip it around. Now for larger dogs, the standard hold is just put your arm around the dog's neck. And the problem with that is if the dog has a long neck, look how far he can reach. Which means that if he wants to turn around, even if you have a good hold, the best hold you can have still allows him to bite you in the face. So one thing that you can do is just turn your hand around. So here, if my hand was like this, I'm just going to turn it like that. So it was like this, and I'm just turning it around this way. Now, when you have your hand like this, look where it is. This is a weird pointer. Okay. Now your hand is right behind his skull, which means that you have control of his head, because that hand is now right here, right behind their skull. So now what we'll do in labs is we'll take treats and we'll try to lure the dog to try to get the treat, because that's how you know if you're restraining well. And now the dog can move its head but not its neck, so it can't reach around as far. And then this is the only time dogs get treats for being naughty. And they're trying to struggle. Now one way to make this even stronger is to have that hand. It was here, I turned it around, and then I put it behind my head. So now you have the dog's neck encircled. So it was here, and I just put it behind my head. So now you can see it goes all the way around the dog's neck. So you have a ring all the way around the dog's neck. Now the dog is really having a hard time turning. So we'll see what that looks like on video. So here's the regular restraint. You can see here how far the dog can reach its head. If you're taking blood, that's close, because your head is close by to the dog's. Now you can see that with her hand behind the dog's head, she just needs to hold the dog against her shoulder. Now this would be easier for her on a table because she could get in a position where she can keep her hand against her shoulder better. And then this is the easiest one because it doesn't require any work because you just have your hand on your head. I had a pet owner who came to one of my conferences, and she said that she had a cane corso who was fearful. And she had the low stress handling book, but she didn't get to do all the counter conditioning. So you can see that here this dog is having problems moving its head now. She's trying hard, but just can't really move its head, kind of giving up. There, we'll give it to her. So the person with the cane corso, her dog was fearful, but she didn't have enough time to counter condition it to the vet hospital because it had to go on an emergency visit, and she hadn't had enough time to counter condition it yet. So she took it into the hospital, and then she did this restraint, and then after that the vet wanted to hire her. So really, for anybody who has their own pets and they're concerned about how the animals do at the hospital, a lot of times the vets won't let you handle your animal. However, if you can handle your animal and they can tell that you can handle your animal, then that's different. So the difference is that most people can't handle their animal, so of course you don't want them handling their animal because you're going to get bitten. You're going to get bitten and sue them, and then the vet's also going to be bitten. But if it's the case where you have clear control of your animal walks in next to you, sits when you want it, lies down, will be positioned the way you want it, then they'll let you handle. You take the book and just say, I'm doing these holds. And we want to counter condition like chapter 18, this section. Okay, here is the importance of making sure that you don't just squish the dog. So in this case, when I was first starting on the low stress handling book, I did not know what I would be able to instruct. I thought, oh, maybe everybody knows everything already. And so what I did is I went to the hospital where I was working, and the hospital is really good. The technicians are fantastic. And I brought Jones, and I wanted to see how they would restrain him, and he kept getting loose. And I couldn't understand why he kept getting loose because I didn't understand what people were doing with their different holds. I knew how to restrain dogs to hold them still, but I didn't know what other people were doing that wasn't quite right, and I didn't always know exactly what I was doing that was quite right. Now I do. Now we've watched so many videos and practiced so much, we know exactly what people are doing incorrectly. But here, the one thing she's doing is she's not actually keeping him from jumping up. He can't move backwards, and it would seem to me that every time he was starting to struggle, he'd just get loose. And I was thinking, gee, it seems like you're just letting him go every time he wants to struggle, so he's learning to struggle. So then, I actually need sound on this.
Growls.
He's on to us.
No, but you should hold him when he.
Okay, so I said, just hold him.
He knows he can get away. So like there,
Even when he's bad,
Yeah.
give him the treat.
more firmly, because I don't.
So
think
then
he
she
should be able to-
squeezes him,
He's
I know he
strong.
squirms,
He's
but-
strong. Stay.
and then it scares him more. I'm like, okay, poor Jones.
Okay, hold on.
So the moral is, if you don't know how to restrain them, don't just restrain them harder. Because what happens there is that if you're putting pressure in the wrong place, then it'll really scare them. Like for instance, one thing I see is people trying to get dogs to sit, and they'll put pressure in front of their hip, which is like breaking their back. But you're not really thinking, you're just kind of pushing down, and for the dog it's like, this hurts, my body doesn't move that way, and now I'm really scared because I think you're trying to injure me. And so that's what's happening with Jonesy here. So here's an example.
A more appropriate way to restrain is to have your arms and body in the right place so that the dog cannot wiggle loose even if he does wiggle. In this case, I'm going to place a ring hold around this foster dog's neck. When she gets scared and struggles, I don't squeeze her down. Rather, I keep my hands and arms in position so that they continue to guide her when she struggles, instead of making her reflexly panic more.
She's sitting anyway, it doesn't matter.
So she struggles, but then I keep my arms on the sides of her so that I have control, and then she stops. So I didn't squish her down. I just made it clear that there's not really much place to go.
She stops within several seconds, and now I can hold her head in position. The problem is that now she won't take treats, even though she was taking them earlier.
Okay, so now she's scared, and I can get her into position.
We counter-condition her
still
for a few
scared.
minutes until she's happy, and then repeat the restraint. Now she's relaxed.
Okay, she was relaxed, so I started petting her. Okay, so I can get her into that position. And then she really should be counter-conditioned to being in this position because it's still a little bit scary for her. Okay, so not only is it important to actually have your arms and hands in the right place when you're restraining them from moving in a different way, it's also important to apply pressure in the right places when you're guiding them into new positions. So for instance, when you want to guide a dog from a stand to a sit, so for instance, the dog, you can't use food because, for instance, the dog doesn't care about food at that instant. And the dog won't listen because he's too nervous or doesn't know how to sit on cue. So in that case, you might have to physically get him to sit. And the way to do that, in order to do that, you have to bend the hind legs And you have to move the weight back about, for this size dog, that weight's going to need to move a foot back. That means I need to lift the front, bend the back, lift the front, and move back. Move the weight back.
And more difficult to handle, which will make them less trusting and more difficult to handle. In this first case, the technician is using correct technique to get Pia to sit. He bends the hind legs, then lifts and guides the front end towards the rear. Notice his shoulders are tilted at the angle the dog's back should be in order to sit. In this case, the technician does not tilt his shoulders, so the dog gets confused.
So watch
as to
that
what
the
he
front
wants.
end is not moving
Her
anywhere.
ears go back, and she starts to squirm. The technician is just pushing her backwards, but simultaneously keeping her from backing up.
So he's just compressing the dog.
Now he tilts the shoulders,
Yes.
and Pia sits.
Okay, this time he moves the
Luckily,
front end
Pia is
back.
friendly and well-adjusted, so she doesn't become overly fearful or aggressive.
But can you imagine, that happens a couple times. If that happened just once at a hospital for you, then that would probably be it for that hospital for you. And yet the dogs put up with this so well. So principle 4 was know how to place your hands, arms, and body to control movement. Principle 5 is we want to use the minimal restraint needed for the individual. It's the comfort that's the most important. And here's an example. This dog has cardiac and pulmonary disease, so if they stress it out, it's going to die.
Doing anything else?
So they're using a towel around it, and that causes a large
Emma, sit.
surface area. It has a large
Good.
surface area of control. And then they're just going to put a catheter in, so they clip,
Good girl.
and she looks pretty happy there.
Good girl, Emma.
Well, what they specifically do is they clip, and then they give her a break, and then they scrub, and they give her a break, and then they just put the catheter in, and they get in the first time because they're really good. So if you have a difficult dog, you need the good people who can get it in the first time. Oops, what happened here? So use the minimal restraint possible. Safety and comfort is the most important. And then 6 is we want to avoid prolonged repeated struggling. And in dogs, I say avoid prolonged repeated struggling. For dogs, I say that's in general less than 3 seconds of struggling. And if they repeatedly struggle, then we want to do something else. For cats, I make it even shorter, 1 to 2 seconds. So what do we want to do if they struggle? Well, number 1, we want to give it a break and start over. And then we want to think about fixing our technique. Because sometimes it's how we got into the position that was important. So for instance, if I have a small dog and I want to restrain it and I want to get my arms over it, sometimes it starts moving. Like if you pull it towards you and try to get your arms around at the same time, that can be enough to make the dog struggle. So often what I need to do is make sure I get the dog close to me, make sure it's stationary, and then I slip my arms in place. So I'm not doing 2 things at once. I'm just, the dog's in place, and then, the dog may have been here and maybe I moved it closer, and once it was in place, I gave it a second or 2 to be stationary, and then I slipped my arms into location. So you have to be careful how you get into position. So we may need to fix our technique. We may need to get a second person to help. Sometimes it's just to put their hand on the rear end so the dog can't back up. Sometimes it's to give the dog something else to think about. We may need to change to a different technique altogether. So for instance, hey, maybe we shouldn't get blood from the jugular. Maybe we need to get it from the hind leg. Maybe we can't take urine with the dog on its back. Maybe we have to do it with the dog standing. So we need to be able to perform different types of techniques or perform the techniques in different ways so that it's convenient for the animal. We should also go to chemical restraint way earlier, because if you wait till the dog is aroused or the cat, then it's not even going to work. So better if you know that that dog or cat's going to be difficult, get an injectable like Domator into it quickly, let it wait in a quiet room, and then do the procedure and then reverse it, and then send the animal home. Because then he didn't really have a bad experience. And then we have to realize that sometimes we don't have an emergency. Like a toenail trim is not an emergency usually. There's time to show the owner how to do it and make it better, show the owner how to prep the dog, or help the dog feel more comfortable in the hospital. So here's avoid prolonged repeated struggle. So let's watch.
Trying to do the neck?
Yeah. Good boy. No. Good boy. We're not actually getting there.
I know. I just pulled it off to make sure.
It's a 5-second fake.
No. Stay.
So this handler tends to just think that, oh, just hold them down and get it done.
He's a good boy.
So let's see what Jonesy thinks about this.
10 years?
And then I made him play with Jonesy because Jonesy was already mentally messed up, before then.
Restrain him that way.
He already has enough behavior problems. I didn't want to make him scared being here.
He's still naughty.
So is he better or worse? Yeah, worse because now he knows what to expect.
Right off guard. He touches legs. Hold on, Jones. Hey, settle down. Hey, Jonesy. Okay, we'll switch arms then. What do you say?
Yeah, that's fine.
Yeah, he does.
There you go. It's
We're
okay.
seeing if
It's
this
okay.
makes him
It's
better
okay.
or worse for next time.
Then he look at.
You're gonna get tired.
He thinks he's going to get tired. Jonesy can run 16 miles, and then when I play fetch with him, like I'll run 3 miles, and I'll be throwing fetch the entire time in the opposite direction I'm running, and then he has to catch up. So he's not going to get tired.
He is a little
So Jonesy, before I put him in this situation, he had already had like, let's see, probably like 100 good experiences at the hospital because he came to work with me. I went down there once a week, and everybody knows Jonesy. They say hi to Jonesy before they say hi to me. So he knows people and he's happy there already. Okay. Okay, handling principle number 7 is adjust your handling based on the animal. So you want to use a technique that works for the animal. It's not just one technique for every animal. It's use the right one for that animal at that instant. So you may start with one technique and then switch to another, which is why you need to understand how to have your hands in different positions to prevent movement in different directions. So for instance, with Jonesy, I kept saying, well, these technicians said, well, we would sedate him by now. And I kept saying, but no, try something else. So they would have been nice to him and just sedated him. Whereas the other guy was like, just hold him still. So I said, okay, well, keep trying something else. I want to know what you would do, what else you would do. So she is not doing anything to keep him from jumping up. She could have just held his collar. And then he would like, can't go anywhere, can't go anywhere. But she's not doing anything to provide any guidance there. But it's okay, because at least they're not putting a death grip on him and holding him in the wrong way that's going to make him worse. What they do instead is they go, well, let's distract him.
And someone would feed him.
So they're going to take blood out of the rear leg, and then I'm going to come distract him with baby food. And now Jonesy just thinks he's having a good time.
Yeah, but you're sticking.
So brains are always smarter than brawn.
Yeah. Good job. We have our blood. Do you want to do anything with
And here's just an example of a cat. So in a cat, if I got this, that would be enough to say do something else. So sometimes you can give them oral buprenorphine and then come back later. And here they decided to just try different positions and cover the cat's head. And that's my example of an OSHA violation. Don't do that. Don't put your mouth on things. So look, this video has dual purposes. Okay, so we're going to go over one case example, putting everything together.
This foster dog, Ivory, has a history of aggression. She gets ear infections, and neither the vet nor the foster mom can handle her. They also have problems muzzling her because she tries to bite. You might just think she's mean here, When I go to put the leash on, she turns to avoid me. You can see that her behavior is based on fear. I easily get the leash on her. Once she's out, she stops growling because she's no longer cornered. To safely pick her up, we place a towel around her neck. I don't have it quite tight enough, so she's able to struggle a little.
So I don't have it tight enough because this is the first time I've done it on a dog because I should have practiced it first. So, yes.
I readjust it once she's on the table. I also pet her head, and she actually likes it. I can feel
The
her
tail
relax.
starts to go down, and then when I stop, the tail goes back up.
This technician has never restrained a dog using a towel, so he's learning a new method. When I remove my stethoscope and stop controlling Ivory's rear end, she suddenly starts to struggle. Once the technician gets her against his body, he has better control.
Like that lip licking.
We muzzle Ivory so that we can perform her ear exam. We're able to do this easily because we have good control of her body first. Now the technician holds Ivory still for the ear exam. Note that the dog is right up against him and secured on all sides. The towel prevents the dog from moving forward or moving the front of the body outwards. The arms along her side keep the side and back controlled. The greater the surface area, the more control. There should be no airspace between the handler's arms or body and the dog. We're also easily able to take blood from the jugular.
So he's supporting on this side, and I'm supporting on the other side.
Now I want to clean the dog's ears.
So look at all this space right here. That's a problem. That's my triangle of
The
escape.
technician is not able to hold safely, so we switch jobs. When dealing with difficult dogs, it's important to have the experienced technicians handling the dog. The person performing the procedure must be able to do it quickly and efficiently and in a way that's comfortable for the pet. Note that my arms are snug against her so that she has no wiggle room. She tries to struggle a few times and then stops. I jiggle her head because it seems to calm her.
Okay, then
Now
it turns
she's done, but I'm not going
turns
to
out he's a
release her
boy.
until she's relaxed so that I can release her in a controlled manner.
So I'm like, why did they name their boy dog Ivory?
Let's see if Ivory's better or worse.
So I want to control him until I let him go.
When I place her on the floor, she looks happy and relaxed. When I go to pick her up, she willingly lets me. She's already improving.
So in summary, our goal is to go from the idea of winning the fight to the idea of creating comfort and security so that we can avoid the fight. So how do we handle these difficult pets in a low-stress manner? First, we learn how to recognize fear and anxiety. Then we learn to greet appropriately so that we can help them feel more comfortable. Then we want to make sure that we're providing a comfortable environment. And we want to make sure that we handle in a skilled way so that the animal does feel comfortable and feels like that we can provide direction. And then we can desensitize and counter condition as needed. and follow specific handling principles. So those principles were set up the comfortable, safe environment, control movement and lead clearly, support the animal so it feels balanced and controlled, know how and where to place your arms and body to provide that support, use the minimal restraint needed for that individual. Comfort is the most important thing. If they feel comfortable and secure, then they'll hold still. 6, avoid prolonged, repeated struggling. So change your method, go to chemical restraint, do something differently. And 7, we're going to adjust what we do based on the animal. And with low stress handling, we're going to open the door to being able to treat more animals more efficiently. We're going to end up providing a good experience for the pet so that it can improve behaviorally. And we're going to develop clients, patients, and staff who are happier with their job. And we don't have time for a quiz because we are at the end of this section. I can take 1 or 2 questions before we take a break. Uh-huh.
This is like really wonderful information, but are veterinary schools changing their programs so that vets get more?
Good question. Are veterinary schools changing their program? I think everybody today should call their local veterinary school and tell them they should change their program. So, because they move in slow motion, right? If they're going to have, with medical, they're up to date on medical. But behavior, that's different for them. Ohio State University has a low stress handling ward, but right now they're the only one and the school doesn't even see the value. Now the reason they don't see the value is because they don't see money directly coming in. If you get a new x-ray machine, you can see that this many people made money on that x-ray machine. But if you're just handling better, the only ways you can measure are client satisfaction, client perception of how much the vet cares, or how many fewer bites are occurring. And if they're not really, they could measure how many fewer bites are occurring, because I've been asked to give seminars because so many people at hospitals a certain hospital have gotten bitten because it's a large hospital. So they can keep track of that, but they really need people to tell them you should keep track of that. And they can keep track of owner satisfaction, because I know plenty of hospitals that say, well, we changed this method and the clients are way happier and we can tell. Or I've had trainers say, our vet started using this method and I can tell that the animals are happier. Or I've had clients come in. I've had one person in Serbia, she was saying that, the vets there, they all just want to do it their old way. Except her friends, she went to her friend's hospital and they had a difficult cat and they didn't know what to do. They were standing outside the cage for 20 minutes, just standing there, and she said, what are you guys doing? And they said, well, we don't know how to get this cat out of the cage. So she did the towel method, got it out, and they were able to trim the nails, and the cat was comfortable, went back in its cage and went home. And then those vets started using that technique regularly for the cats, and then in I think it was 2 weeks, they texted her and said, wow, we're getting a lot more clients because they can tell, like they're telling their friends to come here because my cats get handled well. So the thing is that it's one of those things that I think the public has to drive more, because veterinarians, we have things like Association of Feline Practitioners who are starting to push feline-friendly handling, and we have the fear-free vet visits, which just started, and that's trying to push things at conferences, but the schools are going to be the slowest to change. So I think if people start calling the schools and telling them, talking to them just the way you would talk to your vet, then I think it would start making a difference. There are some schools where they do use the low stress handling book, like Colorado does, and then there's, I forget, one of the schools in Canada, and then there's a couple technician schools, like one in Florida that does, but there's so many, like the majority don't, just because it takes a while for people to change.
Many of the vet schools don't offer behaviors.
Yeah, many of them don't offer behavior as a course because it doesn't make money. Like seeing behavior cases does not make money. You actually get a pay cut if you see behavior consults compared to what you would make as a regular veterinarian. But so what they don't see is that, hey, a behaviorist job is not just seeing consults. It's how you deal with the animal on an everyday basis. And that's what they don't see. Like for instance, even surgeries where dogs go home and they can't hold still. Well, if people were trained to teach their dogs, like you get a treat and train out and train the dog to lie down calmly, hey, then you get your calm dog for the 30 days. Or just being able to learn how to walk a dog on a gentle leader after surgery so the dog can be controlled even though it's not super trained. If they understood that that's what the medical benefit is, that your surgical cases can recover because you know how to train them, or you can do physical therapy. Well, the physical therapists I think are better in that they're using food a lot at least. But I think getting that message out that it's going to help you on a day-to-day basis is maybe more difficult because for one, people in those high positions aren't necessarily in practice either, people making the decisions. So on our end, I'm on the fear-free vet visits and then advisory board, and then I know the AVMA is coming out with a puppy, well, it'll probably be a year, who knows how long, like a puppy socialization statement, and AVSAB, we have some statements, but it needs to come from many different directions, not just us. Like if you guys actually talk to your vets, and even some of you as trainers, how many of you are trainers? Yeah, a lot of you can actually work with your vets now that you have this book that you can say, here, these are these techniques. Do you want me to help you with them? Help you implement them? Because before that, they're like, who are you, right? How would you know? But now, here are these actual techniques that we know that are accepted. So, any other questions? Uh-huh.
On that topic, when I moved from DC to Stafford, the first thing I did was look for a home vet.
Uh-huh.
That reduced from my reactive dog,
Yeah.
it was a world of difference. So when
Yeah.
people ask me, the first thing I say is, oh, Dr. Nicholson, she's a home vet, and
Yeah.
she does great handling.
Yeah.
And my other vet, my behavior vet, she changed the scenario so that she was already in the room when we brought Penny in.
Uh-huh.
And then it was a world of difference
Yeah.
for her.
Okay.
It's the same thing I say to people looking for a vet, or to my, anybody in the profession is just change how you're approaching that dog.
Yeah.
It's a world of difference for them.
Yeah, so it was have your dog examined in your home instead. Because a lot of the house call vets are actually better at handling because they have to be. And then also sometimes just having your vet do something different. But usually, like I haven't had problems if you bring the textbook in and say, my dog has problems, can you do this chapter? This chapter, because you are a vet, right? And you're supposed to be improving your skills. So, I mean, if you say it nicely and they know that you're a good client, then they'll work with you. Teaching Fido to Learn to Earn. So this is my version of a program for teaching leadership in humans and impulse control in dogs. And we'll see. We may be able to do some game show stuff, but we'll see. So I went over yesterday. Oh, how many people are new here today? A couple of people. Okay. So yesterday I talked about how I got into animal behavior was because I had a difficult dog. And it started when I was in high school, and he was a boxer and he was quite big. And one of the things he would do would be if you wanted to get him off the furniture because he didn't belong on the furniture, he would growl and you couldn't get him off. Or basically, if you wanted to get him to do something he didn't want to do, he might be growling at you. And I was working at a vet hospital at the time, and they told me, well, you have to do something about this or you might have to put him to sleep someday. But I wasn't told what I could or should do. So finally, I went to a dog trainer because that's all that was available at that time. There were no behaviorists at that time. And I was told to use the old Keeler method, which is you hook them onto a choke chain and a leather leash, and you run the opposite way, and when they aren't paying attention, they're going to get a correction, and that'll teach them to come and get next to you, come up to next to you. And then when they're not looking again, you do the same thing. So you basically try to catch them doing something wrong and correct them for it so they'll do the right thing. And that worked for the first two corrections, and then somewhere around the third correction, he started lunging and climbing up the leash after me. And at that point, I didn't know what to do, so I got the instructor, and she came over and she watched, and she told me, you're doing a great job. Keep doing the same thing, because she didn't know what to do. So that's what I did. And that started it was at least a 7-year struggle with my dog. So I did everything these trainers told me. I went to many different trainers sequentially and got as much out of those trainers as I could, and I was the best student that they could have. So the first trainer, she told me, choke chain, and then if he growls at you, you should get a stick and put some padding on it and hit him over the nose with it. So I quickly learned that if they can see it coming, they can bite you first. So I say, if you're going to use punishment, it has to be like the hand of God came out of nowhere. I was told to do alpha rolls, where you push them on the ground or on their back, or have them lie down on their side. And yeah, that worked if he let me do that. He would keep growling, but I could get him down. I was told to stand above him a lot. I was told to ignore him for much of the day and then randomly boss him around, where you'd put him through his paces. It would be like, heel, sit, down. And if he didn't do it, he'd get a correction. And what I quickly learned is that if you have a boxer who's pretty tough, back then they used to be tough, then they just ignore you. So you ignore them, they ignore you back. Then later I learned if you have a golden retriever who really wants to please you, they don't even notice that you're ignoring them. So either way, it's really frustrating for the human. Then I was told to use pinch collar corrections because you can get a faster correction and it's stronger. And remember, if you do use punishment, it's better to do it with the right timing and the right level. However, I was told that if you have a pinch collar on and your dog wants to redirect, you're in trouble because you're going to be pulling up and he's just going to feel pain and he's going to become more aggressive. So I was told that if that's the dog you have, you need to also have a choke chain or just a choke chain on so you can strangle the dog down. So basically, if you make your dog redirect you, you need to strangle him down. They didn't phrase it that way. They just phrased it as, if your dog is so bad that he tries to fight you, then you need to strangle him down. So I did that. I used a pull-up bar and I did hang him, and he nearly passed out once, and he did it a second, and then I yelled at him, and he was aggressive again, and so I did it again, and then when he was awake enough, I yelled at him again, and he was aggressive again, which basically shows that, yeah, your dog could be near death, and he may still need to defend himself. And at that time, the idea is, your dog he still won't submit to you. It's without the understanding that, your dog is trying to save his own life because you're still attacking him. And some of these things worked in the short term, but over the long term, of course, they weren't good enough, which is why I kept searching. But it was the only thing that I had at the time. And the whole idea there was put the dog in a conflict situation and then show him who was the boss. So basically, if you have a dog who's aggressive, the idea was take him right into that situation and force him to submit. And to me now, I look at that and say, gee, that's like taking somebody with anger management issues and say, let's go to a bar, and then when you get in a fight, we'll make you submit. Well, yeah, at the best case scenario, the person learns he can't beat up the one person he was going to fight with. But everybody else, he might still try to fight. And of course, with that general approach, some dogs are going to redirect. They're going to try to bite their own owner, especially if they have a pinch collar on. And at that time, there were no head collars. So what were my results with Max? Well, eventually, after many years, I finally found obedience competition trainers who were trying to update. They were using Karen Pryor's Don't Shoot the Dog, so they were learning science. They were breaking down exercises into little pieces and using rewards and shaping. However, they did still use some punishment. And the trainers I worked with all competed at regional and national competitions, and they were the type, you can't compete in your dog unless your dog is going to show well. And so my dog did compete well. He scored somewhere in the 195s, but he wasn't the level of the other dogs in my class. Of the other people in my classes. And although we competed well, I didn't want to continue because I felt like I had already ruined him. So if you saw him in the ring, you might think, oh, he's really good, but I knew that I had ruined him. So I found these really good obedience competition trainers who are actively updating their methods. And he passed and got his title in 3 trials. And he did get the high scores. But he did randomly stop in the ring. And at that time, my trainer thought he was stubborn, and we would just give him corrections to catch up. Remember the other day when I was showing you that dogs lag in the ring when they don't think it's fun? They also will stop when they're confused. And now that I know body language better, I know that when he stopped, he would put his ears out to the side like a huh? And you know, that's not the, hey, you know, make me look when their ears are out to the side like that. So now I know that he was confused, but it would make me really mad because I was told he was stubborn. And the reason he was confused is we didn't practice going longer patterns without talking. Because you know you're not allowed to talk. We needed to shape. We skipped steps. We went from talking a lot and rewarding a lot, and then suddenly going long patterns. So while I did get him so that I could feel comfortable that he would never try to attack me anymore, I did not feel comfortable that he would be safe around others. So if others took the leash, then he would growl and lunge at them, because it would only be if he thought they were going to correct him. So with this dog, one of the things, how many of you have had a dog that was this frustrating for yourself, right? And you know how horrible it is because you loved your dog, but you want to kill him every day. And it's really frustrating because really, if I knew then what I know now, things would be completely different. I could have fixed the problem in a couple of weeks to a month. So I could have fixed that problem in a couple of weeks to a month instead of taking years. And one of the biggest problems is that, yes, we're told that we need to be the leader. And now a lot of people now are saying, oh, we don't want to use the term leadership. Well, it's a term in our culture, and it actually has definitions and meaning, and there are schools of leadership. And what we do want to do is we do want to lead. Because the definition of leadership is someone who gets others to do things that they wouldn't normally do on their own. Yeah, we're getting our dogs to do all kinds of things that they wouldn't just do if they were left on their own, because they need to behave in real life in our society. So yes, we need to lead our dogs. The problem is we're told that we need to be the leader, but we're not told that there are different styles of leadership. You can be a leader like an evil dictator who leads by force and coercion, or you can lead like Gandhi, meaning you're leading by inspiration or some types of rewards. You're working towards a common goal. And I'm guessing most people would rather be led by inspiration instead of coercion. So I do tell people, yes, you do need leadership skills. However, we don't want to lead like a mean, angry boss. We want to lead like a leader in a dance. My name's Dr. Sophia Yin. I'm a small animal veterinarian, and I've wanted to be a vet ever since I was a kid. And so I went to vet school, became a vet, and then got out into practice and realized that more animals were dying due to behavior problems. I feel the key to dog training is that you have to learn to lead like a leader in a dance. In a dance, you have a lead and a follow. The follower is usually a female, and the only way the follower knows what to do is that the leader guides her an instant ahead of time. When he guides her, he has to give signals with his entire body. He's not just shouting out the steps, he's guiding her with his entire body and momentum at just the right instant so she knows what to do. If he daydreams or he doesn't know what he's going to do next, all of a sudden she's going to know and she's going to be confused. If he frequently daydreams or frequently gives bad signals, then she's just going to lead herself. The interesting thing about dogs and humans is that humans communicate mostly verbally through words and verbal language, whereas dogs communicate primarily through body language. So if humans want to communicate with dogs, we have to learn how to use our body and move our body in ways that make our signals clear to the dog. So we want to lead like a partner in a dance. What that means is we need to know how to move our body in ways that help direct our dog, and we need to decide what we're going to do before the dog wonders what the next step is. So we can't be doing, oh, I did one exercise, now let me decide what to do next, because then the dog doesn't know what to do. It's like, how many of you have partner danced and then you want to lead because you have no idea what the other person's trying to get you to do? That's your dog every day, probably. Now, when we can lead like a partner in a dance, like a good partner in a dance, then we can change behaviors quickly. So we can go from a dog who's like this. This dog is fearful of other dogs, has a history of another dog running over to attack him and biting him when he tried to get away, and now he does that to other dogs. He has gotten loose and bitten another dog. Remember, the wagging tail just means high arousal. Okay, in this case, this dog is not ready yet to be worked with because he's moving. If you can see, he's moving slowly, and I have to guide him. So you can tell he doesn't really want to do this. Can you see that? So what I need to do is go back and work with him through the Learn to Earn program inside, develop that impulse control, then work with him, similar exercise outside, get focus, outside too, and then when I get that, then when we see another dog outside, we can perform exercises in rapid succession. Now, when you do these, you would start at the distance where you can keep the dog focused. So that's going to depend on your skill. So there's the other dog. And remember his reaction last time, and you can see here, he's moving with me more. He's choosing to follow me. And notice that these are repeat sits backwards. I do a repeat sit backwards, reward him for sitting, then I go on to the next exercise. I don't stand around waiting for him to look around. I'm going to lead him through different steps. Now he's looking at the dog a little bit, so for me it would be better if I was a little further away or moving faster. And you'll see today in the workshop the difference that speed makes. So since this time we've been looking more at the importance of speed, and if I'm looking at my speed here, it needs to move up a few notches. And if it had moved up a few notches, then I wouldn't need to do the little guiding that I'm doing. But you can see I started further away, and as he was more focused, I moved closer, and now he's able to be next to the dog. And I've worked with this dog for the last 2 weeks. So I've worked with him with a number of dogs, so I kind of know how he's going to behave. So here, oops, she let her dog get in his face. Next time, get a better handler to help you. So here, I could actually step away so that he's not so close to the dog. But at this point, he chose to lie down on his own, so I know he feels more relaxed. Now, the dogs that I did with him last week, it took a lot longer. I'd have to have a session further away, and then I'd stop, and I'd do it again, and then stop. But this total session with this dog was only 10 minutes, and at this point, I know that he's good with this dog based on his history. So this is a situation where now I could just have him off leash in the backyard, for instance. And now, today, this dog can just greet a dog regularly, like have an appropriate greeting where they don't rush on head on. And if he's able to greet the dog appropriately, then he's fine. So we're talking about leadership for dogs. What do we need to be a leader to our dog? Number one, we need to set clear rules. Then we need to communicate those rules. And how are we going to communicate them? We need to communicate them by rewarding right as they perform the correct behavior and removing rewards for the unwanted behavior. So that is not just positive reinforcement and negative punishment together. Both of those things are needed. And I specifically say you need to remove the reward for unwanted behavior within 0.5 seconds. In order to do these things, we need an awareness of our movement, and we need an awareness that every interaction is important. Every interaction is a learning session. And then we need to stick to the plan of rewarding the correct behavior and removing rewards for unwanted behavior. We need to stick to that plan until it becomes a habit for the dog. So it's like that chicken yesterday that I was teaching, peck the black dot, but only when you see a red Q dot. Well, we needed to reward consistently until that chicken knew the new behavior.